and I were not satisfied with the level of care, and I let her know that. 3 hours later, Child Protective Services was knocking on our door because they filed a complaint against us for medical negligence.
Hi, I'm a pediatric hospitalist, which means I take care of sick kids in the hospital, and I've taken care of thousands of children with severe dehydration. I want to start out by saying that I'm really, really sorry that this has happened to you and your family. As a pediatrician who has seen CPS called inappropriately several times in my career, I want to talk about this. Now, remember, I wasn't there for this encounter, so I'm just going to be talking based from my experience and my overall viewpoint of this type of situation. This family presented to an urgent care for their 1.5-year-old for a fever for 3 days, with not many other symptoms as they had explained. And the doctor who saw them there told them that it could be literally anything and told them to go to the ER to get every single blood work done, check their urine, check a chest x-ray, and whatnot. The family, knowing that their child was acting otherwise normal, was eating and drinking well, and just had this fever, felt like that was a little bit aggressive and decided to have him seen at a different urgent care. But they did express that they were unhappy with the care that they got at the facility because the doctor only spent a couple of minutes with the child and told them to go straight to the ER, without really giving them much of an explanation. The physician at this urgent care then decided to contact CPS and told CPS that this child was severely dehydrated and needed to go to the ER for fluids, despite the fact that the child had been eating and drinking normally and had been acting normally and only presented with symptoms of a fever. Now, I wasn't there, I didn't evaluate this child, but if you're labeling a child with severe dehydration and you are calling CPS because of a child with severe dehydration and you are concerned for neglect, then there should be some pretty significant findings on your clinical exam. Anything from sunken eyes, delayed capillary refill, dry lips, dry mucous membranes, and with severe dehydration, as was described to CPS, you would likely be seeing a change in vital signs like tachycardia or a fast heart rate, and possibly low blood pressure. Now, any physician knows that with severe dehydration, your first line of treatment is an IV fluid bolus. And I can't imagine somebody allowing somebody to leave the facility without administering at least one bolus. And if you are concerned for severe dehydration, I would assume that we would be calling an ambulance to take the child to the ER rather than leaving it to the family to bring them there. Now again, I wasn't there, but calling Child Protective Services should never be a simple decision. Yes, some cases it's pretty clear when we need to call, and some are a little bit less clear. But if you're calling CPS as a way to get back at a family, and I'm not saying that that's what happened here, I'm just giving a general statement, that's an abuse of power.